right now. Okay, so hi everyone. We're going to begin our CAG mini town hall series. This will be session number 3, and I will be admitting people as I'm doing the presentation. So if I look distracted, it's because I am. All right. So for tonight's session, we've had 2 really good sessions, and thanks for joining. Today we're going to review the importance of obtaining the composition of all the exposed elements, which we often refer to as the chemical list. We will also discuss, because this seems to be not of total awareness to the community, of the legal tools that the Department of Public Health and the county have to subpoena this information from SoCal Gas. We'll also review the status on the retrospective studies that could be done and should be done already, because again, they're retrospective, so the data is already there. We intended to cover 2 topics today, the complete blood count study, as well as a cancer registry study. And based on some feedback that I got from the CAG members, we've got a long enough presentation as it is tonight. We're going to get everything done in an hour. But we decided that the cancer registry study is too important and a little more complex. Patty was the one to bring that up, and we agreed with her that we're going to push that to a separate meeting. So tonight's going to be the chemical list, as the agenda says, the subpoena authorities that are unique to the county and DPH, and we're going to talk about the CBC study, and Dr. Nordella is already with us to go through that section and answer questions. So does that agenda work for everybody? Okay, great. So just so to qualify again, this is our foundational health study requirements, and I've highlighted what we're going to discuss today, and these are the pending open issues. Chemical list and CBC study. The chemical list is 17 months in arrears, if you will. And
Craig, excuse me,
Craig,
I don't see your shared screen.
I was just going to say.
yeah, it changed screens on me. That's very weird.
There you go.
Is that better?
Perfect.
Yep.
Okay. I don't think I had anything, but I may have. Apologize. So bottom line, 2 topics today, 17 months in arrears and 15 months in arrears on the CBC study. So let's just jump in, but we got some an important update for everybody. If you remember in our last meeting, we quoted a Dr. Christopher Sistrunk of the SOC, and this is his comment that he made at the end of the last full public CAG meeting that DPH hosted. It really wasn't a CAG meeting. It really was DPH just telling us what's going on. And we were just, well, anyway, it wasn't a CAG meeting. So again, I want to reiterate, this is what the man said. He says, it's too much to say. The bottom line, this is a tragedy. And why is there no real concerns for the lack of confidence in this process? Well, there seems to be a sense of doubling down on staying the course that is clearly not transparent. Shameful. This is truly shameful. So important update, Dr. Sistrunk has been removed from the SOC by DPH. And Julie, I have the same feeling about that as the expression on your face. Yeah, so this is terrible. I mean, now we've lost Dr. Nordella, we've lost Dr. Sistrunk, who every CAG member I think will agree with me. Let me let in a bunch of folks here. I think the CAG members would agree that we had 2 really strong advocates that on the SOC that were very community centric, and they are Dr. Nordella and Dr. Sistrunk, and they have both been silenced. Okay, so chemical list, and Dr. Nordella is going to help me explain this. So, but here we go. So why is it important? Well, I think it's pretty obvious, but let's just quickly go through it. Now, the plume that you see coming out of SS25, SoCal Gas actually sampled the output from the blowout itself. They captured gases and did assays or did analysis of what was there. Subsequently, because of all the oil mist that was coming out of there, if you guys recall, about a month into it, SoCalGas put a screen or a mesh over the plume that was coming out to try and capture some of those oils. So we have been told that sampling was done below the mesh, directly coming out of SS25, and above the mesh. So we have SoCalGas has all the information about what's coming out of that well, but they haven't provided it to anyone. So reiterating how big this was, 118 days. It's the largest methane and chemical exposure in US history. For perspective, it's 200 times greater than the Deepwater Horizon disaster. So this is of enormous proportions. The impact to us, it's an unprecedented quantity, duration, and combination of polytoxins over a residential community. That's just the largest, and it's never happened to this magnitude. So, I mean, a layperson would say, you have to understand what we were exposed to move forward in a common sense fashion. Supporting that logical conclusion is the group of scientists at the CCST, which we refer to often because they're this independent panel that is recruited by Sacramento. And the first thing they said about when you go to assess what's going on with the gas storage facilities is you require the composition of the gas withdrawn from the storage reservoir be disclosed, along with any chemical use on site that could be leaked, intentionally released, or entrained in gas or fluids during an LOC, which is loss of containment event. So obviously we had a loss of containment, 118 days, unprecedented. They're saying you have to determine what the composition was of not only the gas, but the liquid and the particular matter that came out of there, not just the gas. That's very important to appreciate. So most would agree that we need the chemical list. We want to stress that DPH and the county, for that matter, have a unique legal latitude to subpoena. Unique in that they don't have to have a lawsuit. They can just subpoena this information if they chose to. For instance, the plaintiff attorneys that are going after the civil suit, they're in a situation where they have a lawsuit, but their subpoena would get blocked by a corporate trade secret that Gas and Oil is able to hide behind in reality. But there's something very unique about the subpoena powers that public health has, in that they can pierce this trade secret veil. So the law is clearly there, and I'll show you the excerpts from the law itself. So the county must lack the political will to go chase this down. You'll hear in a minute that DPH is deferring to Supervisor Barger, but at any time they want, DPH can act upon its own subpoena authority to go get this information, to compel this information from SoCalGas. It should also be recognized that the fastest and simplest path to get to this information has been and is right now with DPH and the county, because for all the reasons that I just described. They don't have to be in a lawsuit. They already have this authority that can pierce the veil of trade secret. So for the sake of the public's own information, and also for the eventual researchers that will be taking on this task, now is the time to go get this data, because Department of Public Health is going to oversee a future study, right? Whether it be the University of Colorado, the University of California at Irvine, whoever's doing it, it makes logical sense to equip them with the most information for them to do a thorough job. So why waste their time and their money? They're not going to go hire a bunch of attorneys to go chase this down. It should be the counties and DPH's responsibilities to get it. So here's just an excerpt from the code. I'll be happy to go over this in more detail if anybody wants in the end, but in order to protect the public health, the basic information of the location, type, quantity, and health risks of hazardous materials, including accidentally released, is required to be submitted to firefighters, health officer, planners, public safety officers, etc. This is to prevent or mitigate the damage to the health and safety of persons from the release or threatened release of hazardous materials. So the law is here. The law is with the county and DPH to do this. So I think a logical question for a lot of folks might be, what has the CAG done? Well, we feel we've done a lot, but the results aren't there, and it's not out of lack of effort on our part. So we, after many, many months, we finally secured a meeting with Supervisor Barger, and this was just in October this past year. And Barger told us straight up that she and Barbara Ferrer, the Director of Public Health, were of the mind that the study is worthless without this list. We agreed, of course. So she offered and promised that she would get the list, but has yet to deliver on anything. So it was her initiation that saying, we'll get the lawyers and go get this, but nothing's happened. We also were promised bi-monthly meetings to keep this issue front and center. We've sent a couple of reminders. No follow-up meetings have happened. We agreed that we would meet before the holidays, and here we are closing in on the end of February. We've also met with Councilman John Lee, and we repeatedly have requested a motion, and he agreed to bring a motion to the City Council urging the county and DPH to follow through on a subpoena. And to our knowledge, all these requests since he drafted something have not seen the City Council. It's also important to note that 7 NCs, and I've never heard of this, unanimously, all 7 unanimously, there was not one single no vote, that they urged the county to use its full subpoena authority to go get this information. That was a CAG effort to spearhead that across multiple NCs, and Brian and Andrew and a handful of other CAG members did a fantastic job in circling the wagons around that. And it was an amazingly easy way to bring people together and say, this is of course what we need. So we've also did a petition, which was signed by 2,500 community folks that went directly to Supervisor Barger asking for the same thing. Every single meeting we've had with DPH, every single communication we've had with them, we have asked for updates. We've insisted that this be done, that we get the chemical list, and to no avail. A little background. Initially, DPH repeatedly denied that they had such legal authority to go get this list. They just said, oh, we can't do it. That's outside of our authority. Letting somebody else in here. So the CAG insisted. We have provided them the legal standings for them to do so. We gave them the legal language, but DPH repeatedly denied that it won't use its subpoena authority. When we asked them why wouldn't you do this? You know, in public health's interest. We never got an explanation other than attorney-client privilege. So they're hiding behind something. They're hiding behind, and we can all speculate. They're hiding behind some deal that was made. They're hiding behind what the policymakers, and because they report to the Board of Supervisors, a path that they do not want them to pursue. And to a point where DPH, and they did this in the last CAG meeting, Dr. Davis quoted, says, well, the CAG has met with Barger, so that this issue is over there with Barger. So they're deferring. Again, DPH can exercise this at any time they wish, but they're deferring to the supervisor's office for this chemical list. And I want everyone in the community to understand, because remember our pillars, right? Push the political agendas out of this study, stick to the science, but that's not happening here. Science is no longer dictating or driving going to get in this chemical list. It's been thrown over the wall to the politicians. That is not how you take care of the public's health. Any questions on the chemical list? Or Dr. Nardella, did I miss anything? Or CAG members, did I miss anything?
Yeah, I'd just like to add that a lot of this could have been alleviated initially if the proper due diligence was done. There was no studies of any of the particulate matter, no matter what size that you inhaled, and there was no analysis of the toxic crude oil. that was spread throughout the community for 4+ months. So improper due diligence again puts a question mark, more so a question mark, on really what you were exposed to, and that could have been addressed right up front.
The other thing, Craig, if I can make a clarifying comment, you did indicate that Councilmember John Lee agreed with the motion. That isn't quite accurate. We have sent multiple requests for him to do this. We have multiple neighborhood councils passing motions and sending letters urging him to do so. But in his meeting, he basically agreed in principle that the chemical list is needed and that he would reach out to Catherine Barger's office and find out what was going on. And then that was it. More
So
inaction.
He was redirected by Barger, you think? Don't know.
I think if I play the cynical card that LA City has their own issue with the Valley Generation leak, which is another, for those who don't know, another very significant year-long methane leak out of that generation plant that was covered up. The fact of the matter is the city is no longer, I think, really innocent in this. So we could be cynical all day long as to why people aren't doing what they're supposed to. The fact is the politicians whose job it is to protect us are not doing their job.
Okay, I'm ready to move on to the CBC study, but any other CAG members have anything to say, or community members?
Yeah, there's one other principle that again, we've talked about the difference between the studies. One is a patient-based studies, patient-centric study. The other is an environmental study that would look at the chemicals that they measured and make a health risk assessment. But what amazes me, if that avenue is chose, which I don't know where they're at with that, that makes it even more inaccurate because you don't have chemicals that you might not have measured for. So again, that makes the argument to me much more compulsive to go to the patient-based study, because you just do not know the chemicals of concern and how it will affect the human body.
Right. Dr. Bruce, you have your hand up?
Yes, I do. I'm going to play the devil's advocate. The CAG does not need the list. The SOC doesn't need the list now. Supervisor Barger doesn't need it. City Council doesn't need it. The entity awarded the RFP is who needs the list. And therefore, until that entity is refused, do we really have much of an argument? Thank you.
I'm going to say you absolutely do, because any research organization is not going to get their own legal team mobilized to go subpoena the list. If anyone has an example of a research or institution that has done that, then I will retract. But I would be shocked if that happened. And even if they did, they are a third-party researcher. They're not the local Department of Public Health. And I would imagine, based on nationally, all of the environmental justice communities that have been trying to get their equivalent list of what they've been exposed to with, I think, universal failure. I think deferring and pushing this can down the road just further complicates the possibility or likelihood that whoever does the research is successful. The fact of the matter is, the group with the easiest path is public health. They should be getting, my opinion, there's no excuse not to get the list and have it sit there ready for whomever, the researchers are downstream.
Maybe they have it and they don't want us to know.
Well, that'd be a pretty stupid intellectual move to do, to say, to not tell anyone they have it and they're keeping it for the researchers rather than just.
Let- Let me add to that just a little bit. The image that is provided by DPH to the potential researchers is that DPH doesn't care, doesn't think it's important. And if they put that image out there, it will be accepted by the researchers. They may not, but it could be accepted by the researchers. And I think it sends the wrong message. If DPH wants to be concerned about the public health, then they should show that they are concerned by getting all the information necessary to turn over to the researchers, so the researchers don't have to go looking for information, but all the normal information is there so that they can decide what to do with it. And I think it's extremely important that DPH be proactive in this rather than reactive. And that's the image that is being presented today.
And say that the researchers decide we need this information, and then they have to go into DPH or whoever to get this information. That sets back the research back how many months?
Let me add some science to that. So if the RFP is being drafted by whomever, not having the list could actually taint the RFP in itself and put the health study on a vector that is not going to address your questions. Now, certainly there could be conversation between the health researcher and the DPH or SOC or whatever. That was never presented to me. But I think more importantly, and I think very, very importantly, actually, if you look at the second paragraph of the goal of DPH, when it talks about disclosure, and it's disclosure to people so they can make the proper decisions for their family. Wouldn't this have been nice to have along the way to say that you were exposed to X, Y, and Z, so that you could sit there and say, you know, I really don't want to be involved or live in this community anymore. I'd like to take my children from here. I would like to do whatever. But that was never supplied to you. And that is a goal statement of the Department of Public Health. And they, by not getting this, are not living up to that goal statement. And they are failing you, the people, the taxpayers that actually pay them for doing that.
I must respectfully disagree. It would create panic. I mean, look what we got to do to deal with vaccines. I mean, imagine having this whole list available to people to try to figure out. DPH also has not necessarily said, A, that they're not going to get the list. Who needs the list is the guy getting the RFP, and he can't respond to the proposal to form a patient-centric study unless that information is obtained. And a part of the mission, as you identified additionally, is to do a gold standard study. So it seems to me that we're going to have, that we don't have it now is not necessarily that bad. It's that it is not going to be available when the researcher needs it is bad. If it's not going to be available at all, the whole thing stinks and it's not going to work at all. And when we learn that, then we got to bounce on these people as hard as possible. But till then, I'm not sure we have that strong of a position. Thank you.
Bruce, and I just want to comment because you have no idea that basically how this overplays with the COVID issue. In fact, I'll send you an article in your personal email if you would like from MedPage by Marty McKay from Johns Hopkins that went through this whole thing that he was told not to disclose information. And this was in regards to the variants of the vaccines and so forth and so on. I don't want to get off the weeds, but the principle holds to this. And it's like, we don't not disclose information from patients and people, PhD or MD. That is not our job. That's not what you took an oath as an MD to do. And I have no idea if they ever took that as PhDs, but we do not. We recommend. We give the positives, we give the negatives, and we leave it to the patients to make the decision. That is not our job. In fact, we withhold evidence, we withhold issues, we withhold information. That's medical negligence. So I do want to comment upon that, and that is not our job. It's to disclose to the people and let them make the decision for themselves. Otherwise, we are playing God, and that's not our position.
We're going to get to Helen here in just a second, and Bruce, you can respond if you like. I just wanted to make one point. Whoever is awarded the RFP, I really doubt the RFP is going to include, not only do we want your science, but we want your legal team as part of the bidding process to go get the information that DPH failed to get. Because we're going to hire, hopefully DPH will hire the best of the best for the science and the research, not for their legal jobs. So DPH is handicapping the researcher by not giving them all the information they need to do their job well. So Helen, you have your hand up, and then Bruce, you can respond if you like. Go ahead, Helen. Unmute yourself, Helen, if you're ready. We'll come back to Helen. Bruce, feel free to respond if you like.
My response is that the people doing the research, responding to the RFP, I can't imagine trying to write a proposal and saying what I'm going to try to accomplish doing the study without having the appropriate information available. And so the researcher, in response to the RFP, is either going to presume that he has access to certain information or not. And we will be able to see when that is released, but I'm not sure that we can do anything before then.
Okay, Craig, I'm here. Can you hear me?
Yeah, go ahead, Helen.
Okay, I have to strongly disagree with Bruce. I don't know if he lives in this neighborhood or not, but he talked about the panic. The panic is already in the community by number of cancers we see around us. So, and if the chemical list, it's that bad that you think we're going to panic, don't you think we need to panic, and the health department needs to panic, and everybody else? Plus, what kind of scientific health study is going to be without that list? We want to have a scientific one. If we don't have a list, so what are we going based on?
The fear from the public health, Helen, probably was that releasing a bunch of numbers could make people even more confused, more anxious, and more uncertain.
Well,
that, I suspect, was the dilemma they faced. And
Yeah,
over the years, government has often not told the public the truth. Anybody studying World War II or the Civil War, any crisis situations, often the public isn't told what's happening right away, and it's a significant fear.
Yeah, but
That's what I'm thinking. I'm certainly, Helen, not defending them in the least, and I agree 100%. We can't do a study without this information, but it's not necessary right now.
Well, I know for me and my family, it's very necessary to have that list, because we don't even know what we were exposed to, and we are not feeling well.
What would you do with it?
Well,
what would you do with it? If you had the list, what would you do with it?
At least I would try to detox. I would talk to professionals to see, okay, I was exposed to these things, and this is what's happening. How can I get rid of this junk in my body? I have the right to know.
What if you ran into charlatans? What if you ran into people who were trying to take advantage of you by cooking up stories about these numbers?
No,
then you think that you want to take your chances.
Well, that can happen with any kind of problem. You go to doctors, you can have good doctors, bad doctors. It's my choice who to go to. I want to have that choice. I want to have that option. It's just somebody else deciding for me. It's not right. Department of Health is deciding for us that we are not supposed to have this list. And I think it's all right because that the gas company put all this junk in our body, and with health department knowing that, as you said, they might have the list. They just don't want us to have the list.
Yeah, and I think it's also, it's not numbers, it's chemicals. So every person has the ability to seek whatever care they wish from whomever they wish. And it's not up to DPH to worry about charlatans. It's DPH's issue, as it states in their goal statement, is to inform. So it's disclosure, so people can make the proper decisions for their own personal health, their family's health, and that of their loved ones. So I just don't think it's up to a governmental agency to make those decisions. That's the point. Now,
But isn't the study, isn't this the purpose of the study, to be able to provide that information to the public, to learn? It's my understanding that we really don't know the full impact of periodic high exposure and prolonged low exposure to petrochemicals. And I was under the impression that that's what the purpose of the study was, to find out how bad it is.
well, Bruce, how can they do that if they're going to do an environmental study and a health risk calculation? If it goes on that vector, which I don't know it's going to go, but how are we going to do
it can't.
Right. So your point, which is taken, I understand what you're saying, but sitting on this for a year, when they talk about developing the RFP, you're saying that RFP is going to go off and they're going to say, hey, UC Irvine, whomever who gets the contract is going to say, we need the chemical list. And they're going to go back to DPH. Now, reasons have already been given to the SOC and actually to the CAG too, that there's a legal binding that they can't get the chemical list. So I think that even the researcher that comes back and requests the chemical list, they're not going to get it. Then you have to ask yourself, which it sounds like you've declared that, is that where do you sit with your opinion then? What will the study be like? Don't know, but it certainly would not be as robust if we knew the chemicals.
The worst part of all of this discussion is that if you delay the knowledge that we could get from the chemical list, there is nobody who can take any action on their own with their own doctors to mitigate the impact to them. That is a terrible statement to make. DPH or any entity should be looking at this situation, and I'm coming from a layman's position, and saying, I need to provide you with all the information possible so you can manage your own health and try to mitigate issues with your doctors. If you delay this for another year or 2 years or 3 years or whatever it turns out to be, you become complicit in allowing people to be further damaged. Now, there may be some logical statements that can be made that maybe 2 or 3 years isn't enough time to cause a major problem difference, but you take that right away. And I don't see the government as having the right to take that away. I don't see a corporation's desire to make money against its competitor as a right to take that away. And I think that the issue is the concern for the public's right to choose and the public's right to have information that has affected them. And I don't think there's any argument about that.
One scientific quick input I'd like to make is that don't forget, you have an acute exposure with all kinds of chemicals, but you have to answer the question, are you still being exposed? And if that answer is yes, what are you still being exposed to? Is it different from those chemicals? I take it would be, because we don't have the chemicals that that was in the mud to stop the blowout, but you are exposed to chemicals. And if you are exposed to chemicals, again, do you not have the right to know for whatever reason? Of course we do. You know, we don't live in Venezuela. We live in the United States
Is
of
that a
America.
legal right? Do we have a legal opinion here? Do I have the right to know what chemicals I'm breathing as a patient? Is that a patient right?
Of course it is. And it's actually right in, you just named it. It's the patients have a Bill of Rights. And they do. If you read it, I'll be more than happy to send it to you. But if you
To
read
whom
it,
do they appeal?
I'm so sorry I missed that.
To
Who do they
whom
appeal? Who
do
they ask?
they appeal to for their Bill of Rights?
Well,
And how do you ask it?
the first place is that they appeal to the people that have the known knowledge, which should be Department of Public Health. Second, if they do not disclose, then that person under a legal act called the California Claims Tort Act, if they're damaged, have an action against the state, and not necessarily against the state, but the person within the state. So those are ways of appealing.
Then Prop 65 would cover this too.
Yes.
California makes everyone declare what chemicals we're being exposed to. You see that everywhere. So
Bruce, you might not have been on the call when I did this. There is a health code that the public health entities and firefighters have. The legislators approved this. They have.
Yes,
the
I saw
right
it, Craig.
to get it.
Thank you.
Okay. So we do need to move on because we want to cover the CBC. So why don't we go ahead and move on, and if we have enough time at the end, we'll revisit this in the Q&A section. Does that work for everybody?
No problem.
Okay, so I'm going to defer to Doctor because he was kind enough to join us and walk us through where we stand on the CBC.
Okay, so the CBC is just 5 seconds. As you know, we looked at the chemical of concern, of the most concern, which was the benzene because of the carcinogenic effect of it. So went back, approached a lab, got 11,000 CBCs over an 11-year period, looked at zip codes of non-exposure, 3 different ones, and compared them basically to the Porter Ranch 91326 neighborhood. Went from, and I believe I'd have to reflect back to the data. It was all adult. It was 18 and above, and just looked at the basic data. It wasn't a study. I never claimed it to be a study. It was a probe. It was looking in just to the data. I collected the data. I worked with different people and assigned the data to them, untouched, went to statisticians. They pulled and did the calculations, did the p-values, statistical values, and found interesting things that concerned them and concerned researchers up at Berkeley. And they found not a low level, for clarification, but a statistically significant difference between the mean, okay, between non-exposed communities and exposed communities. That's all it was. I attempted to supplement that data with more data. Went to Quest, worked with them for 6 months, brought the point up. 2 weeks before I was denied, they asked me if I was working with the Department of Public Health. I said no. They asked why. Said I had an issue with them, that community has a trust issue with them. I had a trust issue with them at that time, and I got denied. So Quest Diagnostic cut off the data, would not give the data over. So I presented what I had at the town hall. Now, in December of 2019, I met with Dr. Paul Simon at a restaurant in the San Fernando Valley, and we had breakfast. And I explained to him everything that happened, gave him the data, gave him the names, gave him and introduced him to the statistician. And he was quite concerned about the findings, to the point where he said, after he went through his small due diligence, which took him about 4 weeks, basically stated that the the statistician was absolutely qualified. He had a conversation with her, wanted to use her as he would be reaching out to get the data from Quest, because Quest is one of the biggest providers. So Quest initially, he had asked NICE. Quest said, no, we're not interested. We're not going to give it to you. Here we went back to the subpoena power. Paul, would you file a subpoena? Nope, not going to do that. Finally, it's taken now, we're what, 15 months? And I
Yes.
think there was just a paragraph posted someplace that now they might next month get the data. Well, in the meantime, you know, yes, you have COVID, totally understand, they're very busy, but 15 months? It took me 2 weeks to obtain the data and 2 weeks for it to be analyzed. And this is 15 months. So those are the facts of the matter. And now, as they listed, a primary care physician in the community did this. Now I'm terminated from the SOC. Wow.
That was in the DPH's recap that Christina Vega sent out last Friday.
Do you have that?
I can get it. So you go ahead and finish the story and I'll grab it.
Well, that is basically the story. So again, this has not been finished. There's no conclusion to it except that there is a concern. Now, the difference is I would like to continue to move forward. And a lot of times they want to halt it and not have it looked at. But again, this is why I come up with a conclusion. It's like, look, or don't look, don't find, don't tell. So I just don't feel scientifically it's appropriate. It certainly, again, does not live up to their goal statement. Disclosure to the people.
Craig,
So
you may
I got
want
a
to look
screen
at
share
the,
here.
Craig,
I'm sorry, Brian, go ahead.
you may want to look at the chat and you may want to bring some of that up because it speaks to the issue of not having a list.
Jane's comment?
Yes.
Jane's online. Jane, do you want to speak to it?
Speak to it. I just, I took the testing that we did with Dr. Nordella with the hair and urine, you know, our graphs and the whole record of what they found in our, you know, hair and urine. And when I showed that to my doctor at Cedars-Sinai, he just, I mean, he looked aghast and he just said, literally what I said, I have no idea what to do with you, or I have no idea how to help you. And he said, I don't even know where to send you. So, you know, I quit going to doctors, but I'm going to call you Dr. Nordella.
My point by bringing that up, letting her bring that up, is that had that doctor had a chemical list of potential ingestion, he might have had a different opinion about what to do, where to send her, and how to address the issue. But without that, he has nothing to go on.
I'd actually like to go in a slightly different direction. And that, because what Jane just brought up reminded me of my own visit to the emergency room and having to have a conversation with the doctor and say, basically, were you here in 2015? Were you at this hospital? Where were you? Having to quiz him, only to find out he wasn't. And I said, have you ever heard of this event, the blowout? He's like, I have no idea what you're talking about. And I had to sit there and spend 10 minutes educating him on, you know, very high level stuff. Part of the reason why the list is so dang important is because public health's job is to distribute that information to practicing physicians all around the county so that they have an idea already when they are looking at a patient that maybe, you know what, it's a question they ask on their intake form. Did you live here from October 2015 to February 2016? These people, the physicians you get, 99.9% of them are going to have no idea about what happened. They probably weren't even here at the time. The DPH's inaction in getting this information and providing it to healthcare providers continues to completely handicap every single member of the public's ability to get quality medical care. And if that was the only reason they went to subpoena this information, that would be good enough. There is no excuse for them not to do this. I don't care how we cut it. Thanks, everyone.
So bringing that back to the discussion, the fact is, if they aren't doing it for the medical profession at the moment, under conditions where people are being treated, then what is to make us believe? Where is the faith that they will get it at all for any researcher at
Thank you.
any time?
Thank you. If it, under the best conditions now and they're choosing not to, it's illogical to assume they ever will make a serious effort later.
They've had plenty of runway to get, so we could, because I don't want to wait 3 years after the guys publish it, and when I could have been doing something to prevent a very serious disease. All right, Helen's had her hand up. She's waiting patiently. We're kind of moving into the Q&A. So Helen, go ahead, and I'm going to wrap up the presentation.
I know some of you are aware, but I don't know if the other ones are not. A little story. One of our visits to ER with my daughter, when she was vomiting violently, I mean, extremely bad. And they had also closed down the Holy Cross triage and ER triage because everybody else was just like my daughter, throwing up that bad. When I asked the doctor, could you please do a toxicology test on my daughter? She, what's causing this? Why is she being this way? After repeating a few times, the doctor told me I cannot because of the letter they got from health department, Dr. Rangan's letter. And I, at the time, I didn't know what he was talking about. I said, what are you talking about? He took me to the computer and he showed me on the screen the letter. I said, this is because of this. I cannot do any tests on your daughter. And that stopped us from knowing what she was exposed to at that time. And to this day, we don't have any information of what she was exposed to. And we are still getting sick. So I have bitterness. Everybody knows, especially toward Dr. Rangan and health department, because of that incident.
Important real event that without the information you can't move forward. Okay, so you kind of put a bow on what we've talked about, and then we'll open up for some more Q&A, but we still have some time. So the conclusion is the Aliso Canyon Disaster Health Study must really be anchored on a demand for the chemical list. We can argue about the timing of it, but the substance of the study must have it. The focus must be on evaluating the people's health. Bruce talks about it all the time. The gold standard. He holds up a study that's been in medical professions for decades. I can't think of the name of it. Bruce and Dr. Nardella will bring it up. And we should not accept the lower version of an environmental risk assessment approach. It will be inconclusive. So those should be our demands as a community, certainly as the demands of the CAG. I just want to reiterate how long we've been waiting for this. And this all leads to the voting of the CAG. And again, why the majority do not have confidence in the path that it's on. The recent test survey that was done, it's 9-2, 1 abstaining, saying that we do not believe that we're on the right path. So there are things the community can do. Fire off emails, be professional. These people work for the Department of Public Health. They're in charge of the direction of the path of the study. They should be certain to hear your opinion. Demand the chemical list. Demand that the CBC study be done timely and be fully transparent. And demand that the study be patient-centric. I think these are undeniable attributes that the vast majority of the community would support. Okay, with that, we're going to go ahead and have open conversation. This will be on our website, so you can get those emails later if you like. And looking for anybody that wants to raise their hand for a question, comment, concern.
Well, don't forget to mention Dr. Nardella's town hall this Thursday.
Good point. Antonio, you're new to the group. Julie, any questions? You're still muted.
While people are thinking, I just want to point out, for those who don't really know me, I'm an accountant by day. In my profession, having less information is unequivocally never a good position to be in. I don't understand what the community is going through now from the blowout and from the general existence of this facility, why anyone in government would think less information is truly the better option. It is quite frankly and unequivocally the wrong philosophical position to be in.
Thanks, Andrew. Helen, you still have your hand up?
Before you go to Antonio, let me just state that the only bad question here, folks, is the question that's not answered. So ask whatever you want and whatever you think of.
Yeah, how you doing? Can you guys hear me?
Yes.
Yes.
Okay, sorry. Yeah, I'm new to the group. Yeah, I'm still going through it right now. They found me in my bed. I actually passed away, and I was on life support for a while. Doing dialysis. So yeah, I had a question I've been trying to ask. I got a few law firms that I'm part of. Yeah, I lost my hearing, my teeth. I'm still going to the hospital right now. I've already had a few surgeries. Yeah, I just had a question because I haven't had any answers from anybody. I mean, I have stacks of paperwork. I was homeless. I got evicted while I was on life support. And I actually got threatened by the gas company, saying that if I kept calling, that they were going to kick me out. They were going to cut off my water and power. So I have a lot of paperwork still to this day right now. I mean, I lost my home, I lost my dog, I lost everything, even my life included. So yeah, I have a whole lot of concerns why they're not. I mean, they actually kicked me out of the hospital, banned me from 2017 until last year. I just finally had to file a grievance with my insurance company. So I've been battling this for a long time and still battling right now. Yeah, so I do have a lot of concerns. So I'm happy to participate. Yeah, they actually banned me from the hospital. They kicked me out and told me to get my medication from my lawyers. I was in a coma in the hospital, so they pretty much banned me from every hospital. They erased me records from the hospital. I had to get them from my lawyers, and I'm still collecting. Right now, I'm still collecting. So I had to file a grievance. It took me 3 years. I'm just able to see a doctor. Last thing I know, when they kicked me out, I was still bleeding from my left ear. So yeah, I'm just trying to figure out why they're not. It's taking so long, you know, and I'm going through the worst of it. And and I feel like, you know, I don't know, they just kept sending me back and forth, lawyers sending me back and forth to the hospital for me to get kicked out left and right. So yeah, I just don't know. I'm still shocked as to why they're not letting this, you know, why there's not nothing's happening. Nobody's knowing about this, and nobody knows that I even pretty much kind of exist. But and
yeah, it's the longer they wait, the more distance they put between the events in people's illnesses. So
yeah, and it's sad. Yeah, and I'm like, I was sleeping on and I haven't been, my living situation's been real bad since then. And I was on dialysis. I started losing teeth when I came out of a coma. So I have to have all implants. And I'm, like I said, it was just a horrible thing. It was a horrible thing. I can't sleep. I have bad headaches, still nosebleeds. And
are you still in the area, Antonio?
No, I've been bouncing around. I mean, just sleeping on couches and people floors. I mean, I even slept in a doghouse. my friend's actual doghouse. And I'm like in a living room right now. I'm actually gonna go to somebody else's place. I've been bouncing around since I was on dialysis. When they kicked me out of the hospital, literally 5 doctors walked up to me and kicked me out. So I have sorry, I got shakes now. I'm pretty bad, but yeah. So I'm happy to be a part of this. I didn't know this existed. I have like 8 law firms that were emailing me. I was when I got out, I was in a wheelchair. I mean, I have crutches now. I was on dialysis for a long time. And I was actually calling the gas company. I could see the waves of gas. I could smell it. I could taste it. And it was in my mouth for a long time on my tongue. So I'm just wondering, I don't know why this is still going on this long and nobody said anything. And,
No, we agree. I mean, your
yeah.
testimony here kind of fuels the drive to get to some answers. Thank you for filling us in on what you've been going through. Mary, you had Gary had his hand up, and then we'll go to Mary. Gary, unmute yourself, Gary. Mary, stand by. Mary, why don't you unmute yourself while Gary's getting ready?